Okay, so let's just dive right in today. We are tackling a topic, a question really, that has been around for a long time in environmental health research. And that's, is there a real measurable link between living near, say, a golf course, an area with heavy chemical use, and the risk of developing Parkinson disease?
It's a link that's always been suspected, I think. Biologically, it makes sense that pesticide exposure could be a factor in PD risk, but the data, it's been hard to pin down. So our mission today for you is to really break down a recent study that, well, it cuts right through that fog. They didn't just look at distance, they went deeper.
Deeper into the how.
Exactly.
Yeah.
They looked at drinking water contamination as a specific route, which gives us some of the real-world proof we've been looking for.
And the source material we have is, it's fantastic. It's a very focused analysis of a high-quality population-based study. So we're going to get into the specific numbers, the percentages, the odds ratios that really pinpoint where and how this risk gets amplified. We want to give you those clear takeaways.
Right. It lets us move past just a general fear and into understanding specific pathways of risk.
Yeah.
And that's crucial for public health.
Okay, so let's set the scene a bit. What was the actual study design?
Well, this was what's called a case control study. They used data from the Rochester Epidemiology Project in Minnesota, which is an incredible resource.
Right, that project has been going on for a long time.
A very long time. And it'll let them look at a huge window. From 1991 all the way to 2015, they identified new Parkinson's cases and then matched them with controls.
And that time frame, that's almost 25 years. That feels really important.
It's vital. It means you're looking at long-term exposure, not just a brief snapshot. So they end up with 419 new PD cases. Median age was about 73. And they compared them to over 5,000 matched controls who were around the same age.
And just for context, this was a specific population, right?
Yes, very much so. It was a regional Minnesota population, generally older and predominantly white. That's just important context to keep in mind when you think about these findings.
And what's really impressive here, I think, is the detail they went into. This wasn't just drawing a circle on a map around a golf course. They tracked a whole bunch of exposure variables. Of course, they measured the simple distance, but they got way more granular. They looked at whether people lived in a public water service area that actually had a golf course within its boundaries.
And then they layered on top of that. They looked at whether those water service areas were in what they called vulnerable groundwater regions.
So they were really trying to trace the path of the chemicals?
Exactly. They knew the risk isn't just about being near the source, it's about the transmission pathway. And to make sure they were isolating that effect, they adjusted for everything: age, sex, income, race, whether it was an urban or rural setting. That kind of rigorous control is what gives you confidence in the numbers.
Okay, let's get to those numbers. Let's start with the one that I think grabs you right away, the raw distance effect. Simply living close to a golf course. What did that do to your risk?
Well, this finding it's a powerful first hit. They set their baseline as people living more than 6 miles away. And when they looked at people living within just 1 mile of a golf course, they found a 126% increased odds of developing Parkinson's.
Wait, okay, 126%. Can we ground that number for a second? The study calls it an adjusted odds ratio of 2.26. So in really practical terms, does that mean for every one person who gets PD living far away, you'd expect to see more than 2 people getting it in that 1 mile ring?
That's a really good way to think about it, yeah.
Yeah.
It suggests that exposure is more than doubling your probability compared to the baseline. And an increase like that, it's dramatic, something you got to pay attention to.
What's so interesting to me, though, is how that risk changed as they looked further out. You'd think maybe living right across the street would be the worst, but that's not quite what they found.
No, and that's a key detail. When they looked at the whole distribution, they concluded that the greatest risk zone was actually in that 1 to 3 mile radius. That was the real hot spot.
1 to 3 mile zone.
And then after that 3 mile mark, the risk generally started to fall off pretty significantly.
That's a fascinating distinction. Because if the highest risk isn't right on the fence line, it strongly suggests the problem isn't just breathing in spray while you're, out for a walk.
Precisely. It hints that the chemicals aren't just staying put. They're spreading out, permeating the local environment. It suggests more of a plume effect.
Which, of course, leads you directly to the next big question.
The water.
The drinking water. Here's where the study, I think, gets really compelling, because they're not just guessing about the transmission. They're testing the idea that the municipal water system is the conduit.
And the results here are incredibly robust. It did a very direct comparison. People in a water service area with a golf course versus people in a service area without one.
And the difference.
It was profound. Living in a water service area that had a golf course inside it that was associated with nearly double the odds of PD. The adjusted odds ratio was 1.96.
So to sharing a public water source that might be getting runoff from a golf course, that alone almost doubled the risk for an entire community. That's
Right.
wow.
It's a huge implication for local planning, absolutely.
So to really prove this water pathway theory, they had to compare it to something else, right? Like people on private wells.
They did, and it was a very telling comparison. They looked at the risk for people in those golf course water areas versus people who use their own private wells. Wells that draw from a different, often more localized source.
And what did that show?
The people in the public system with the golf course still had a higher risk, specifically 49% greater odds compared to the private well users.
Okay, so even with all the potential issues a private well might have, the data is really pointing to the public water system connected to the golf course as being the bigger problem here.
It seems to be yes. The largest effect sizes are consistently pointing toward these shared public water systems as being the primary mechanism here. And that really shifts the conversation, doesn't it? It moves from being about individual choices to being about regional infrastructure.
Which leads us perfectly to the last piece of the puzzle, and I think maybe the most scientifically satisfying part. Connecting all this to the ground itself, to the geology. They had to look at this idea of groundwater vulnerability.
Yes, because if we're trying to connect all these dots, the whole contamination idea only really holds up if the ground allows those chemicals to get into the water system in the first place.
So vulnerable groundwater just means the ground is more like a sieve than a filter.
In a sense, yes. It's highly permeable, so runoff moves through the soil and rock much more quickly and can enter the water supply, which you'd think would magnify the risk.
This feels like the ultimate test of their theory, then. If you layer everything together, the golf course, the public water, and the vulnerable geology, did the risk get even worse?
It did. Dramatically.
Yeah.
This is the big validation point. When a golf course was in a water service area, and that area was also classified as having vulnerable groundwater, those individuals had 82% greater odds of developing PD compared to people in areas with less vulnerable ground.
82%. Not because they lived closer, but because their community was built on top of the wrong kind of rock and soil. That just seems to lock it in, doesn't it? We're looking at a hydrogeological problem.
Precisely. That specific combination golf course, shared water, vulnerable geology, it produced one of the biggest effect sizes in the whole study. And that changes the policy conversation completely.
Right.
It's not just about regulating pesticides anymore. It's about regulating them in specific high-risk geographic areas.
So does this mean the recommendation should be to map the geology first and worry about the exact distance second? Is geology maybe the strongest factor here?
I would say the study shows they are interconnected, but geology absolutely defines the highest risk zones. You can't change how far someone lives from a course, but you can manage what chemicals are used based on the ground beneath it.
That makes the data so much more useful for regulators. It's not just a blanket golf courses are bad, but a much more detailed map of where the real public health risk is.
Right. And we should also remember the limitations. They controlled for a lot, age, income, all of that. But they couldn't control for everything. They couldn't know the exact history of every chemical used on every course, for instance. So this study establishes a very, very strong correlation tied to water, but it's one important piece of a bigger puzzle.
That's a really good way to put it. So let's bring it all home. What does this all mean for you listening to this?
The key takeaways seem to be really focused. First, there's this clear risk perimeter. It's not just about living next door. It's this zone, particularly between 1 and 3 miles out from a golf course.
And second, and this is maybe the bigger point, the danger seems to be directly tied to shared water service areas. And that risk is magnified hugely when those areas sit on top of vulnerable groundwater. The real danger zone is at that intersection of land use and geology. It really does change how you think about community planning. An established golf course isn't just a place for recreation. In some geographies, it's a potential chronic exposure source for the public water supply.
Which brings us, I think, to a final provocative thought for you to consider. Since this study so clearly flags municipal water systems and groundwater vulnerability as these huge risk factors, it raises a really big question about regulation. How much coordination is there right now between a town's water utility, the environmental agencies, and the local planning board? If a planning board approves a new golf course in one of these vulnerable areas, are they required to talk to the water utility about the long-term public health cost?
Right.
That's a crucial question to explore in your own community.